Hello and welcome to another edition of Wellbeing on Spectrum Television. Wellbeing is an interactive program designed to encourage a healthy living. My name is Mary Joseph. Please do well to follow us on all our social media platforms at Spectrum TV, or you could visit our website at spectrumtv.ng. Measles is a highly contagious viral disease that accounts for about 2.3 million deaths in children under the age of 5 each year. This potentially deadly infectious disease resides in the nose and throat of infected children, which weakens their immune system, making them vulnerable to other infectious diseases like pneumonia, diarrhea, and often leads to death. The World Health Organization and UNICEF reported an increase of this vaccine-preventable disease by 79%, with Nigeria being among the top 5 countries with the highest number of cases being recorded in 2022. But in as much as there have been campaigns and conversations tailored towards measles prevention and vaccination over these past years, it is quite disheartening to see more lives being lost to this deadly disease. Well, today on Wellbeing, we will be talking about measles, and I have a guest who will be highlighting some of the issues bothering around vaccination so that parents and caregivers could weigh in on the benefits. But before then, let us quickly take this time out. We'll be right back. You're welcome back to the show. It's still the program Wellbeing, your wellness talk show that is designed to keep you health conscious. Do remember to follow us on all our social media handles at Spectrum TV, or you could visit our website at spectrumtv.ng to be a part of the family. Today on the show, our focus is on measles, a potentially infectious disease that affects the skin, nose, and throats of children under the age of 5. This infectious disease can often be uncomfortable as it comes with peculiar symptoms such as fever, rash, and diarrhea. My guest is the State Health Promotion Director, and on this interview, she appealed to parents, guardians, and caregivers to be vigilant of this resurgent outbreak of measles in the state as well as the country at large.
My name is Mrs. Margaret Lawrence Etim, the Director, Health Promotion, Akwa Ibom State. It is important for people to know that measles is one of the childhood killer diseases, and measles is caused by a virus called measles virus. And measles on its own is a deadly disease, highly contagious, but preventable through vaccination. Measles in Akwa Ibom State, we have an outbreak of measles, and that is why the National Primary Healthcare Development Agency, through the Akwa Ibom State Primary Healthcare Development Agency, and the partners, beginning from World Health Organization, UNICEF, AFENET, Red Cross Society, and all, they have come together to help the states, not only Akwa Ibom State, all the 37 states, including FCT, to ensure that we nip measles at the bud by vaccinating the children. Measles is caused by a virus called measles virus. The symptoms, I will come to that, but let me make people to understand that measles virus resides in the nose and in the throat of an infected person. It is characterized by the following symptoms. 1, intense fever lasting 3 to 5 days, above 38 degrees Celsius. followed by blister-like rash. We call it maculopapular rash in medicine, behind the ears. It descends to the neck, to the face, and down to the trunk, that's the body. The child with this infection has runny nose, what we call catarrh. The child has cough, and also at times with angular stomatitis. The child will have these blisters all over the body. But there are certain distinctive features that will make you to know that though the symptoms exhibited are vague, tending to represent other disease conditions, there are two distinctive features that when you see on this child, you know that the child has measles. And that is one, the child will have the redness of the conjunctiva. We call it in medicine conjunctivitis. The white part of the eyes will become reddish. Additionally, if you open the mouth of that child, you'll see what we refer to as coplic spots. That is the white roundish patch inside on top of the tongue, the maxilla, every part of the inner part of the mouth of the child. This is a distinctive feature that will make somebody to know that that child has measles. The virus resides in the nose and in the throat. It's very highly contagious in the sense that if one child affected with measles is in a class, that child poses a risk to the entire children in the class, in the church, wherever the children are gathering. It's highly contagious. Yes, it affects some adults. Some adults whose immunity is quite low. That is why it is important for you to maintain, to boost up your immune system by taking some supplements, some vitamins, and so on. We have the integrated measles vaccination campaign, which we plan to kickstart on the 30th of October through 14 November. Some LGAs, we are going to stagger it. 15 LGAs will commence from 30th, while others will commence 6 days after. Then, reason being that we want to ensure that we give our children the potent vaccine that will mitigate and then protect them from this disease called measles. The measles vaccination campaign is not for all and sundry. It has eligible targets. The eligible target there is that children from 9 months to 59 months, that's before they are 5 years, are eligible for the measles vaccination campaign. You can attest to this that before we had been taking measles vaccine at 9 months. But despite that, some children will still go down with measles, though not very serious. Researchers came up and discovered that 1 dose at 9 months is not sufficient to give the child maximum protection. That's why right now, a second dose is given at 15 months of age through 18 months, but before the child is 59 months. That's before the child is 5 years. That is why, to really ensure that children have this measles vaccine, governments have come up with a booster dose that we are carrying as integrated vaccination campaign, irrespective of the child's immunization status. Even if the child had had the one of 9 months, had the 15 months, with this campaign, the child is entitled to take because it is a booster dose. As long as they are still within 5 years of age, they are eligible to take the vaccine. For this integrated measles vaccination campaign, it's not all about measles. Other vaccines are incorporated. For instance, routine immunization will be given to children from birth till 23 months. That's before they are 2 years, where we give them their oral polio. We call it OPV 0 for the newborns. For those that, depending on their age, OPV, polio vaccine 1, 2, 3, and so on. We have the pentavalent vaccine, the triple vaccine, that is for pertussis, tetanus, and diphtheria. We call it penta, and the other 2 vaccines. Then, that one is given penta 1, penta 2, and penta 3. We have the hepatitis O given, we have the meningitis A, and we have the measles. There are so many we give to them. The BCG, even from birth, for tuberculosis. Then at the same time, we have the COVID-19 vaccine given to people from 18 years and above. Additionally, pregnant women, lactating mothers, people with underlying disease condition where we refer to as comorbidities, like maybe hypertension, diabetes, and so on. Those disease conditions, if you have those disease conditions, you must ensure that you have your COVID-19 vaccination to protect yourself and give you maximum protection for your life and for your loved ones. Not only that, we are going to take the birth registration, because there are some children that were not born in the health facilities. That they were born out of the recognized health facilities. Some of them were born in churches, some in the TBA's home, some in their homes. So there's need to get information on them. That is why the state government, we have collaborated with the National Population Commission, NPOCSI, to ensure that such children are being given their birth certificate. And we capture their data. So all this is all encompassing for the campaign. Measles vaccine is like any other vaccine. When you know how contagious the disease is and the complications associated with it, nobody will tell you to take your child for vaccination. Because by the time you weigh the benefits and the disadvantages, you see that measles vaccine is like any vaccination, is like any other vaccination. You will have some mild feverish conditions, or maybe the area might be swollen or reddish, and it will go off for a few days. As opposed to the complications of measles disease, whereby the child could become blind permanently, or the child might have swollen brain, encephalitis, or the child might have pneumonia and might die as a result of the complications associated with it. No parents should try that. Just get yourself, because by the time, if you look at the mild reaction and the complications, which one will you go for? Certainly you will go for the vaccine, and the mild reaction will just wave up for 2-3 days. Just fever, swollen place. It's like let me make you to understand that with those reactions, we know that the drug is working. That is in terms of the side effects. But I want to tell you, the vaccine will go to build the child's immunity against the disease. Even if when that child is exposed to the disease, the child cannot go down because the child has been protected through vaccination. Let's talk of accessibility. The campaign is not going to be in health facilities alone, so that nobody would say, no caregiver or mother would say, I didn't have the transport money to take my child to the facility. This campaign will be made available at all government health facilities, from the tertiary, secondary, and primary health facilities. Also, the school, because the target age here, most of them are in school. So the school will be made a vaccination site so that we can reach out to these children in their numbers. Also, churches, mosques, motor parks, town halls, wherever people gather, this targeted audience gather, we reach out to them in the communities, motor parks, town halls, village halls, and so on. Markets, wherever we do that. Wherever. We are taking the vaccines into the community to ensure that we reach the eligible targets. So now, talking of affordability, all vaccines are safe, very, very effective, and are free of charge. You can't get to a facility or any vaccination site and somebody will ask you that you should pay some money. That is quite against what we are out for. I want to let you know that mothers, caregivers, they must carry along the child's vaccination card so that when they get to the vaccination site, the health workers looking through the card might observe that the child has need for another antigen. Might be meningitis that the child never received, and that child will be given that vaccine. For this information to be cascaded down the grassroots, as I am doing in the states, in the 31 LGAs, the LGA health promotion officers are doing the same. As I speak to you, they have already gone on advocacies to the key stakeholders, traditional rulers, local government chairmen, the religious leaders, the Christian Association of Nigerian Assembly of the LGA. Then in LGAs where we have the Muslim communities, the imams too have been contacted. Also, they have made with the ward focal persons, the ward development committees, the TBAs, faith-based organizations, community-based organizations, as well to pass this information. They have had series of community dialogues with community members. They have community meetings with parents, mothers, and caregivers, just to ensure that appropriate information is being given to them. That is about the disease, the causes, the symptoms, the vaccine that the child is to be given, then the date of implementation, locations, and the time of administering this. All this information have been made available to the community members. Even in the states, all the 31 LGA chairmen were engaged. Ministry of Education, Information, State Universal Basic Education, the National Association of Proprietors of Private Schools, NAPS, because most private schools we often encounter non-compliance, and that's why we work with their executive to ensure that this information gets to all the private nursery schools, private nursery and primary schools, so that by the time the health workers get to the school, they will not give an excuse that they were not informed. So from planning to implementation and monitoring, there's collaboration and coordination with the key stakeholders. The media, you know, as an individual, when I talk, I'm only educating one or few persons. That is why the media sector have been reached through public service announcement, jingles, documentary, phone-in programs, and so on. The social media handles that are on top of it, all in a bid for accurate information to get to the target audience, the caregivers, the parents, so that they can reach out to their neighbors and friends. Each vaccine has a different finger for marking during vaccinations. For this measles, just like the polio, where the little finger on the left of the child will be marked, for this measles vaccination campaign, the left thumb of the child will be marked so that people will know that that child has been vaccinated. Again, in the states and in all the 31 LGAs, we have what is called CRIC, Crisis Communication Center. This is a committee saddled with the responsibility of debunking the myths, misconceptions, rumors, and so on concerning vaccines. Not only COVID-19 vaccine, any vaccine at all. Reason being that our people are scared because of ignorance. If only they will get to the appropriate resource persons or resource materials to read for themselves and be well informed. Because one thing is, when you are not well informed, you are misinformed. And the moment you are misinformed, you are deformed in total. So for you to come out of this, please reach out to the experts, or you can read up yourself. There's one thing called social media. It has a double edge, or it's a double-edged sword. It has its advantages and its disadvantages. It is one area where we have a lot of infodemics. Lots and lots of informations are there. It is therefore left for you to reason out and try to find out which one is correct, knowing that social media is an open access, subject to no verification. Anybody can post anything, and within few hours, the whole world has read it. So, try as much as possible to reach out to the experts. WHO, UNICEF, National Primary Health Care Development, Akwa Ibom State Primary Health Care Development Agency, Ministry of Health. Please read out and get yourself well informed so that nobody can come to deceive you. Somebody that doesn't even know as much as you do might come from the blues just because he heard something from the social media and come to talk to you and you decide to believe. No, it's not done that way. So try and get scripturally, our God said, the people perish as a result of what? Ignorance. So let us not perish because of ignorance. Let us try and get what we need to know. Daniel learns by books, scripturally. Study to get yourself approved, a good workman unto the Lord. All these are scriptures that God has given to us to ensure that we are not distracted from the way we should. Additionally, I would say, please, my people, Avail yourself of this opportunity. Get vaccinated. Get your COVID-19 vaccine. I did it. Forget about the myths and misconceptions surrounding it. Some say it will light bulb. Then with a failure in the power that we've been experiencing, if it was really true, people would have been using their shoulders to emit lights. All these are fake news. So nobody is taking your data. There's no 666. I had it first and second and the booster, and I'm still alive, healthy and healthy, talking to you now. So please, do not be deceived. Avail yourself of this opportunity, because God will ask you, how did you care for that child I gave to you? This is one question you will answer God. And that is why we are saying, key stakeholders, parents, caregivers, please avail your words the opportunity of getting them vaccinated, as well as yourself. Ensure that you vaccinate yourself against COVID-19 so that you can live long for us. We love you.
So that was Mrs. Margaret Lawrence Etim, the Akwa Ibom State Health Promotion Director, and we were talking about measles, and she advised parents to take their children to the nearest designated health centers to get vaccinated. Thank you so much for being a part of the show. Remember that you can also be a part of the family by following us on all our social media platforms at Spectrum TV, or you could visit our website at spectrumtv.ng. Join us next week for another edition of Wellbeing. My name is Mary Joseph. Do enjoy the rest of your day.